Welcome to Clean and Comfort. It's 7:41 p.m. It is 6/24/2020. It is Wednesday. Today we have a special guest from a hospital in New York City, and we have our regular guests. So Liz will take over from here and then introduce everyone. Liz?
Hi, Dion. Hi, everybody. So today we are joined again, fortunate to have Dr. Carr with us. Dr. Carr has her PhD in public health. We're joined also by Jeff. Jeff is a director at a top New York City hospital, director of environmental services and linen. And then, of course, we have myself and Dion, both overseeing environmental service departments. And then we're also joined, fortunate enough to be joined by Ben. And Ben is a patient experience expert in the New York City region, again, with some of the top New York City hospitals and some hospitals throughout Westchester. Ben, we invited you here today. We're so lucky and fortunate to have you. We really want to talk about how you can help us ensure that the return of our patients see the best possible patient experience, whether they have COVID-19 or whether they're here in one of our hospitals for another either elective procedure or emergency procedure or care that they've been referred to one of our hospitals for. So I guess we're going to just start out by thanking you for joining us and then asking you maybe to explain your role and how your work can help support environmental services efforts to ensure the best possible patient experience.
Thanks for having me. Happy to be here. So I'm a patient experience program manager is my title. I've worked for my hospital for a number of years. And a lot of my work, obviously, it focuses around patient experience, making sure we are communicating with our patients from, no matter who it is in the hospital, make sure we're positively communicating. And that has really been challenged during COVID-19. Anywhere or challenges include even just wearing a mask or having limited visitation. A lot of people are afraid of infection. And so how we communicate and how we're thinking about that going forward is really important.
Yeah, it's all really important points. Before we go on, I was thinking to ask you this. A lot of our staff that were not frontline healthcare workers, back office maybe, some of the admitting roles, some of the really important human resource and support roles. Were you redeployed during the COVID-19 pandemic? And if so, what department did you spend some time with?
So I split my time between the operations team and the command center. And then I had the pleasure of working with one of our EVS staff members who worked in the hospital lobby and first floor areas. It was an eye-opening experience. I learned a lot about the EVS team and the work that you guys do.
Wow, I think we all have some questions for you on that. We're so happy that you were redeployed with environmental services and that you can share that experience with us and talk about a first impression area and an area that sees a lot of not just healthcare workers using maybe restrooms and first floor and public entrances and spaces, but also the patients that we did see. If their first impression of these spaces is not positive from the start, we often say, what are they going to be thinking about the rest of the cleanliness of the hospital? So we would love to dive a little bit more into what you experienced working alongside of environmental services. And then, of course, the command center, the engine behind it all that kept us both motivated and strategically aligned across all parts of the healthcare system. Our command center is so important. So tell us a little bit more about your experience working with environmental services during the high peak COVID census in New York City.
Yeah, so one of my nurse leaders actually posed this question to me, I'd say maybe a week or two ago. And they said, Ben, what did you learn when you were working at EVS? And what I said was, I had no doubt that EVS worked hard. I see the work that happens every single day, but I had no idea how, detailed and how much pride people take in the work. I was blown away by the EVS person I worked alongside of He's worked for the hospital for over 20 years. I joked he was like the mayor of the first floor of the hospital. And everyone that walked in, all staff, even some patients, he was saying hi to, checking in on all throughout the time I worked with him. And I was really impressed by that because, we always talk about it's not just your job responsibilities that in our hospital, but we want you to go beyond that, to be a good community member, to be a good, sometimes we say citizen, and he really, really embodied that. So that really impressed me.
So Ben, tell me, as a person of EVS and a person who is a professional housekeeper, and we're reopening our patient experience. Give me some tips on how to maneuver through our patient experience journey during COVID.
Definitely, yeah. I read a really good article. I forgot the citation, but it was about keeping the lens of how do we keep our patients safe and how do we make our patients feel safe and how do we keep our staff safe and how do we make our staff feel safe. So when I personally think about that with EVS, it's the things you talked about. If you walk in the hospital and the rug that you're walking through the lobby on is for whatever reason dirty, and what I learned is to keep that rug clean, you have to clean it at least twice a day. People perceive it as maybe this hospital is dirty, or maybe it hasn't been disinfected. So the high level disinfecting work that you guys do, super important. But on the perception side of things, the whole appearance of the hospital is so important to make our patients feel safe, our visitors feel safe, and our staff feel safe.
I know Dr. Carr last week spoke about shiny floors. What is the saying, Liz?
Shiny floors equal higher scores.
Shiny floors equal higher scores. And I think Dr. Carr had a thought about that, and she felt it was so true. And what do you feel about that, entering a patient room as a patient, and that's already not feeling well? How can we manage that process? Okay.
Definitely. So, the basics are, number one, you knock on the door, right? So that space for that period of time is the patient's room. That's their home. And so even if it's a semi-private room with two patients, we want to knock on either the door or the wall and introduce ourselves. Hi, I'm Ben. I'm from Patient Experience, or I'm from EVS. And then you want to make sure we tell the patient what we're there to do. So I'm here to clean your room, to make sure that everything's taken care of. And then before we we let them talk, obviously, too, and listen to what they have to say. But before we end that interaction, it's important to ask the patient if there's anything that they would like us to address while in the room, whether maybe it's taking out the garbage or adjusting a tray table. So we give them a chance to voice any concerns they may have.
Thanks for that. I'll definitely use that. Jeff?
Ben, I was thinking about something the other day, and you just reminded me of it because of you're mentioning about working on the first floor of the hospital that you were at and in the lobby and making sure that things are meticulous. And what made me think about this was that, right now my hospital is kind of, I would describe it as some growing pains in trying to reestablish normalcy in the visitation process. And as a result, we have limited visitation hours. We're dealing with like a backlog, a bottleneck effect of people waiting to get into the hospital. We've talked a lot about how much we can control and what we can do while we're in the front line. But I was curious to know, does the visitor experience, like people coming to visit family members and friends in the hospital, how much does a visitor's input affect the satisfaction scores, the patient experience scores that we monitor? because I would imagine that if somebody's really trying to get into a hospital and they're finding challenges such as long wait times and then being a little inconvenienced about the measures to check them to make sure that they're safe, like the temperature reads and things like that. I mean, do you and your peers foresee that could be a negative factor in how the scores are calculated?
Definitely. So, and the way I would put it, oftentimes the population that kind of grades the hardest is the geriatric population, the older population. And the reason for that is oftentimes the person filling out the survey may be a family member. And so, I can even tell you, I was reading through some Press Any comments the other day, a couple weeks ago, so during the pandemic, and they were, filled out by a family member, and that family member said, I don't know what happened in the hospital. I wasn't there, and that person's the person they were talking for, they had dementia, so they couldn't tell them either. So, that's an extreme example, but yeah, a lot of times we'll have, middle-aged children of patients filling out surveys. So they can definitely have a much more scrutinizing eye. They may only experience part of what goes on during the hospital stay. So it's really important that we make sure that the patient has a positive experience, but also to make sure that family member has the positive experience too, or visitor.
I must agree with that point you made, because I experienced it firsthand. Because I also help manage a geriatric floor, and I always mention that we definitely need and must have good housekeeping service after 4 o'clock, because that's usually when the guests start coming in. Now, during COVID, the visiting hours have changed, but when we go back to regular visiting hours, most people come in to visit their grandparents, their parents, after they get out work or after they get out school, which is after 3, after 4, after the first shift of housekeeping leaves. So the second shift really has to make sure that the floor stays nice and tidy for those guests.
I have a question. I have a question. As someone who is familiar with the process, being the difference between cleaning and disinfecting, I would like to know, post-COVID, it's very important that we are able to express and explain to our patients what the difference is, because now they're hearing all this language speaking about disinfecting. How, as environmental service or someone who's explaining or responsible for the patient experience, how would you express the difference? How would you explain that to the patients?
That's a great question, and I'm going to have to lean on the EVS team for this too. From my firsthand experience, the difference between cleaning something and disinfecting, when we terminally clean some outpatient rooms, myself and the person I was working with in EVS, we basically bleached the entire room. Now, I think probably Dion or Liz or Jeff can do a much better job explaining that to me. But what I can tell you is that room was clean. There wasn't any, I'm not the expert on it, but we bleached every single surface in that room.
Well, you sound pretty expert for sure.
I
think the best thing to do is really just very simply say, I'm going to clean and disinfect all the surfaces in your room, and pay very careful attention to the high touch surfaces, such as your call bell, your handrails, and some of the surfaces in the bathroom, to ensure both your comfort and your cleanliness and safety, during your stay.
I also agree, Liz, and I think right now is our staff. I must honestly say that our staff before COVID was a little on the fence about handrails and call bells. Now, I would round and I see